All right, so thank you everyone for joining me today. We're going to cover training for dog and medical grooming procedures. This is otherwise known as cooperative care. It's something that is much needed in the animal care industry as far as I'm concerned. I think all animals should be trained so that they can receive medical care in the most calm and safest way possible, or at least so that they feel safe. Obviously, medical care or grooming should be safe for the animal just in general. Otherwise, it's a little bit counterproductive. So we'll get going here. Just to let everybody know, I do have a couple of birds with me. They are busy eating seeds and stuff right now, so they should be quiet, but they can get a little bit noisy. You may also hear my dogs barking in the background. Also, this is recorded. So if you want to stay off camera, I don't know if I've got it so you can even turn your camera on, but if you don't want to be seen on the recording, I would suggest that you leave your camera off. So to get going here, my name is Bob Siemens. I'm a Karen Pryor Academy certified training partner. I'm an accredited dog trainer through the International Association of Animal Behavior Consultants and the vice president of the Alberta Force-Free Alliance. You can find me online at Instagram or Facebook at Unity Training and Behavior. And on the right here, you see my little family, my 3 dogs and my fiance. The fiance is her name is Kirsty, and then below her is Bella. To the right of Bella is Ryder, and then that beautiful hound there is Frida. So what are we going to cover on the agenda today? We have, first of all, what is cooperative care? What does it mean when an animal is participating in cooperative care? Why do we want cooperative care? What does it do for the animals? What does it do for us? How to train it, and finally we're going to go over the bucket game, or a modified version of the bucket game. I do have a video of someone performing the bucket game, but I am going to show a little demonstration on how to teach a modified version of it. So what is cooperative care? So I would call it, this is my definition, so you probably won't find this anywhere else. And if you ask somebody else, you may get a little bit of a different definition. So it is grooming or medical care in which the animal is a voluntary participant. So in this, we are going to split this down into what can be trained and some examples, and what it means for the animal to actually be voluntary, or what it means to be voluntary for the animal to participate in the cooperative care. So what does it mean to be voluntary? Would anybody like to make any suggestions or guesses? Feel free to type that in the chat. There are a few things that I have actually broken it down into. I think I have about 5 or 6 different points for what it means to be voluntary, or what we need from the animal, or what the animal needs to be experiencing in order for it to be voluntary. Not to force. Yes, exactly. That is one of the primary things. Anybody else? They're given choice. Yes, absolutely, 100%. So we get one more. All right, so I've broken it down into these 3 things. Ability to opt out. Yes, that is one of mine. So consent, essentially, is what it comes down to. The animal is consenting to participate. So the animal is going to actually opt into the procedure and say, yes, it's okay for you to do what you're going to do. This needs to be trained. There is no other way around that. The second thing is no restraints. So there's nothing physically preventing the animal from leaving. So we're not tying them down. There's no kinds of nooses like you might see on a grooming table that is actually holding them in position. Nobody is holding them, so there's no force, as Aurora said. Now, there may be some procedures or positions you may want to actually train your dog to go into that may prevent them from moving in a certain direction. In zoos and things like this, they'll often use little chutes like you might see in a horse stable or something like that, or like a cattle farm or something, where the animal is kind of directed into a smaller area. I am actually recording this meeting, so it will be posted in the event afterwards. It'll take me a little while to process it and to do some editing and stuff like that. If you want to record it, by all means, but it will be there as well. So there may be, like in a zoo, they may use these chutes in order to get the animal into a position where the zookeepers can actually safely work with them. So for a giraffe, they may actually have platforms so that the giraffe's head is up high and they're working at the giraffe's head level, which may make it easier to deliver treats and things like that, or so if they needed to do x-rays on the giraffe's teeth or something, that may be super helpful. A lot of people I've seen will train a stand between your legs position with the dog. So the dog will do a chin rest, which would be the opt-in behavior. But the dog will be standing right in between your legs. So the dog may not be able to move forward, left or right, but if it wanted to back out, it would, and we would not stop that. So the next thing is choice, which was one thing Rebecca said. So the animal can say no. When the animal says no, we respect that. So during the training process, your animal may pull their head away or from whatever it is they're looking at, or if you're doing a chin rest, they may pick their head up. And in that training process, I would say that you would go again. But if you're actually performing a medical procedure and your dog says no, then I would stop right there. Or a grooming procedure. Say you're cutting your dog's nails and you get through one paw and you go to do the next, and they pull their paw away, you might choose to stop right then and there. We don't want to break the dog's trust, and we don't want to give them or teach them that when they say no, it means that you're going to go back in. Now, if your dog were to pull away and then opt in again, then it may continue. Next thing is predictability. So because these are trained behaviors, we want the animal to know exactly what is going on, what is going to happen. I like to compare it to if an alien came down, abducted you, they use their anti-gravity beam and suck you up onto the spaceship and throw you on a table, and then they have all these tools and things like that, but they don't speak English, so they can't tell you what's happening. It might be a little bit scary, or a lot scary. But if they could pull you up and talk to you and say, hey, look, we're actually just doing a study. We want to learn a little bit more about your species. It's not going to hurt. This is how we're going to do things. This is what's going to happen. And then we'll bring you back home. It's not a problem. You might be a little bit more inclined to participate, assuming you're okay with aliens abducting you. And finally, we want to make it fun. We want it to make it enjoyable. We want to use something the dog is willing to work for. So whether that's treats or a toy, some dogs may actually work for pets, praise, and attention and things like that. We want the dog to actually want to participate. And in order to do that, it needs to be fun and enjoyable for them. If they're not having a good time, they're going to say no. One little caveat to that is we want to be careful that we're not making whatever it is that we're using too valuable. We don't want something that the dog says, I never get that. This is a once in a lifetime opportunity. I'm going to participate in this no matter what. First of all, you may actually lose your behaviors may break down a little bit because the dog is so excited and so antsy. And second of all, they may not say no. Even if they're uncomfortable, we want them to actually say no if they are uncomfortable or they're not having a good time. But when it's something like that, if your dog is absolutely 100% ball obsessed and you're trying to use a ball to train cooperative care, they may never say no, but they may not be having a good time. And this is all about making sure that animals can say no and will say no when they're uncomfortable. So what kind of things can we train for medical and grooming procedures. So these are just a few examples. But we could do looking at teeth, or doing x-rays on teeth. I would not want to do anything like actual dental work without sedation and anesthesia or painkillers and things like that. We could do looking at eyes, or maybe providing eye drops or something like that, looking and cleaning ears, inspecting the body, making sure there's no cuts and scrapes, lumps, bumps, bruises, things like that. Body palpations, so when they actually start pressing a little bit harder, say, does it hurt here, does it hurt there, kind of thing. If the vet wants to look or listen to your dog's heart or breathing, that kind of stuff can be trained as well. Blood draws are very, very common in zoos for animals, or for animals to be trained. And the gastroscopy. I saw a video of it. I couldn't find it. It's from Zoo Spenceful is where I saw it. I have a couple of videos coming up in a little bit from Peter, who's the guy who runs that. But he had a video. It was one of his friends that he worked with. I believe it's even off this. You can find this video on a free course that they offer on Cooperative Care. They trained a seal to take a gastroscopy. I'm probably not saying that right, but essentially they stuck a camera down the seal's throat cooperatively. The seal was not under anesthesia or anything like that, and he was paid very handsomely after. In the video, they speed it up, but I want to say that this camera was down the seal's throat for about 8 minutes or so. So it was quite a long procedure, and the seal just took it. It was amazing to watch. Grooming. So we can do things like cleaning teeth, cleaning eyes, cleaning ears. Maybe if you come in from a walk and it's raining, and your dog's feet are all muddy, potentially washing their feet. Baths can be trained cooperatively. Nail trims can be done cooperatively. Haircuts, or just basic grooming kind of stuff, can be done cooperatively. Brushing, checking for ticks and burrs. So basically, if there's anything that you can think of that could be done without anesthesia, or putting the dog under for a little bit, you can probably train it, as long as it's not going to be overly aversive. Things like doing surgery, or maybe giving stitches or things like that. Dental work, anything that might be painful for the dog. Oops. So I've got a couple video examples to show you. So this is Quentin. He's an African gray parrot. And this video was provided by my friend Robin at Canada Bird School. So this was taught nail trims, nail grinding. So she's actually going to use a Dremel. She asks Quentin to do nails. He puts his foot out, which is the opt-in. She holds it with her hand a little bit, touches the nail with the Dremel really quickly, and pulls it back and gives him a nut. So here's a little quick video for that. The biting is, he's not actually biting her. He is just putting his mouth on her. He's not opting out though. He's not pulling his foot away. Next up here, this is Robin again. We have her doing nail trims for cockatiel. So this is, I'm not sure, I don't think this is one of hers. She does have 2 cockatiels. That's also what I've got sitting here on my arm. So this is like a scratch board. We train scratch boards with dogs all the time. I would use something obviously a little bit bigger than a pill bottle, an old pill bottle. What I did for my dogs is I actually made a little piece of plywood board, put a sheet of sandpaper on there, and I taught them to scratch that to do some nail trims. So this is very, very similar. The same thing can be done with your dog. And you get to see. There. Sorry, my bird is demanding head scratches and making it hard to pay attention to what I'm doing. Next up, this is me, and this is Frida. So Frida was on allergy desensitization shots for a while. It was about a 9-month round of shots. It started off where she had to get them I think it was every 2 days or every day, something like that. And slowly you start spacing them out until it goes to about every month. I think it was every month for the last 3 months or 2 months or something like that. So I trained this. So in this video, you'll see she does a chin rest, puts her chin on the ground. That's her opt-in behavior. So that's her saying, yes, okay. I pick up the skin just behind her neck, put the needle in. I'm a little bit terrible at it. I'm not a vet. So this is not something I do all the time. I do struggle a little bit with pushing the needle in and trying to hold her skin up and everything all at once, but she works her way through it. At the end, I pull the needle out, she picks her head up, and she gets rewarded heavily. So I actually have a large pile of hot dogs in between my legs that you can't see right now. But just a side note on this, she did stand up on me one time in the middle of giving her a shot. Was never able to get her to do it again. I could probably retrain it, but I didn't need to. We were done the round of shots, so it's not something I did train anymore. And yeah. I had something else I was going to say about that, but I can't remember. So these videos, the next two are provided from Peter at Zeus Pencil. Fantastic guy, super great trainer, and super nice and smart guy also. So this one is the cooperatively putting eye drops into the seal here. So the trainer asks the seal to do a nose target to the hand, which is sustained. So the seal actually holds it there for a couple of minutes. The trainer drops a couple of eye drops into the eye, and then he probably gets a fish afterwards. And this one is doing x-rays on the seal's teeth. This was kind of a similar thing. They asked the seal to open his mouth. He holds his mouth open for a little bit. There's one tech that slides the lead blocker or whatever it is that they put in your teeth when they do x-rays to stop the x-rays from going too far through. And then another tech actually takes the picture. And there's the shot of the x-ray. So I only included one dog example for this. And that was because I wanted to show that this can be trained for more than just dogs. If they can do it with seals and maybe giraffes. Actually, I think I do have another video. Yeah, one more, sorry. So here they're also doing x-rays. On the left, we have this little puppy here who is trained to lay flat on his side. They do a little body manipulation to move the leg into the right spot that they want, and then they take a couple of pictures. On the right here, we have it with the giraffe, and again, they're doing the same kind of thing as they do with the seal, trying to, looks like they get x-rays of the teeth. So they use this stick here, what we would call a target. They get the giraffe to target the stick. He holds it there for a little bit. They take the picture, and then they reward him off to the side. So one thing I'd like to really point out about that particular video, and I'll play this one again so you guys can see it, is you may have noticed the puppy at first. You may have heard the tail slapping against the table. He was super excited to be doing what he was doing. And then the tech starts manipulating his body a little bit, and the tail stops. So we don't know exactly what's going on there. We may guess that the dog was excited, didn't really like the body handling a whole lot, so that's maybe why the tail stopped moving. Or maybe that was possibly trained for him to just lay completely still like that. My guess is that the body handling may have been slightly aversive, but because he knew what was going on, so there was predictability, and he was going to get rewarded with something he really liked, so it was potentially a little bit more enjoyable, he was willing to work through it. So let's watch that one again real quick. And pay attention to the dog on the left. Watch the tail thumping, and then see where it stops. There you can hear the tail, see it. Starts moving that leg a bit, and it stops. See a little lick lip there, which is maybe a little bit of sign of discomfort or stress. Another lick lip, but he worked through it, and then he gets rewarded after. So it was definitely worth it for him to work his way through that and deal with getting the x-ray done. So because it is cooperative does not mean the dog is always 100% enjoying it, but is willing to work through it for whatever the end reward is. As long as it's not overly aversive, most animals will be able to handle it. So why do we want cooperative care? Why do we want to do this? So first of all, from the animal's perspective, potentially yours and even your groomers or your vets, is stress. When we don't train cooperative care, the animal doesn't know what's going on. It doesn't know why it's going to do that in the groomer. It doesn't know that having these things done are actually beneficial for its health and will make it happier and healthier in the long run. Similar to how we can tell a child that we can go, we go see the doctor and he's going to do some tests on you and make sure that you're healthy so that you're not sick later. Because we can actually verbally communicate that with a person or a child, it makes things a lot less stressful. But when we take the animal out of their home, bring them into a building they've never been in, or maybe never been in, or every time they go there, maybe they get poked and prodded at. So it's a place probably they're not super comfortable being in at the first place. And then you have a stranger come in who's putting their hands all over the body, maybe poking them in places they don't like. That can be incredibly stressful for your dog. But if we can make it predictable, that will lower the stress a little bit. Stress leads to bites. So not all dogs, but a lot of dogs, if they get a little bit too stressed out, they will sometimes bite. And also stress is just in general bad for your health. Being overly stressed, super stressful situations and things like that can lead to a lot of different other medical issues. In some animals, an acute amount of large volume of stress may even kill them. It's safer for everybody involved. So this is where the stress of your vet or groomer may come into play. So if your dog is potentially going to bite or has a bite history, if they're trained with cooperative care and they know what's going on and they're able to say, yes, I want to do that for the reward that comes at the end, those kinds of animals are a lot safer in these kinds of situations. Some animals may not bite for being touched or poked or prodded, but sometimes if they're restrained, they may bite. And then in certain procedures, like doing those dental x-rays, blood draws, things like that, if we need to put the animal under anesthesia, just anesthesia in general has some potential health risks for the animal. And finally, it's easier. We don't have to fight with the animal. The animal has opted in and said yes. It makes the job go a lot faster. And of course, the safety aspect is one of the huge things. So now we're going to get into a little bit of how to train it. Before we do that, we have a few things to cover. So expectations. Set your expectations accordingly. What are you training? Are you training nail trims on a dog who's never had their nails trimmed before, so a brand new puppy maybe? They've never had a quick cut, which hurts for the dogs. It may move really, really quickly. Or maybe you're working with a 7-year-old dog who's been forced nail trims throughout their entire life, had their quicks cut a couple of times. That may take a little bit longer. If that's the situation you're in and you have a dog or an animal who needs grooming or medical care now, so if their nails are too long, they're sick, they're hurt, whatever it might be, take them to the vet, groomer, whatever, get it done. And from there, you want to start actually training it moving forward so that you don't need to give that kind of stress to the dog anymore. So certain procedures may take longer to train than others, depending on what they are. That seal that had the camera stuck down its throat, that did not happen overnight. That probably took months, if not years, of training to get there. Train at your dog's pace, so don't rush it. If your dog says, so last night in the video that I'm going to show you of the modified bucket game, I actually worked with 2 dogs. So I started off with one of them, and I'll go over this disclaimer a little bit later when we watch the video. I started off with one. He made progress really, really fast, but I wanted to get the beginning steps of it. So by the time that I actually did whatever 10 to 20 repetitions, and I was ready to get my camera out, I should have had my camera out first. I wasn't able to get the beginning steps with him anymore. So I moved to another dog to get the beginning steps of how I trained it. And she was moving a little bit slower. I wanted to get to the point where I could potentially just look in her ear, which is what I got with the first dog. But just the smallest hand movement I made towards the other dog's head freaked her out a little bit. So there was no way I was actually going to be able to train that whole procedure in a night. And the other one, I got it done in probably about, I don't know, 45 minutes worth of training. So train at your dog's pace. Don't rush it. Some dogs need days, months, weeks to train for some procedures, and some may nail it immediately within a day. I have a question here in the chat. So it says, what about throughout the process? Can you work CC at home and get the nails done at the vet and still make progress? Yeah, I would say that you absolutely can. So CC stands for cooperative care, or maybe counter conditioning, depending on what Lauren means. But a large part of this kind of stuff depends on the environment. So the environment sets up a lot of the cues and signals to what you're doing. So if you train that at home, and maybe it's going to take you a few months to actually train that, you may need to go to the vet or the groomer and actually get the nails trimmed in between. And yes, I would say do it at the vet or the groomer. Don't do it at home. Do all your training at home until you can get to the point where the nails are clipped. And finally, so the last thing that we want to take in mind before we get into how to train it is set your criteria. So this is actually super, super important. What are you training and what will it look like? What is your end goal? So for the modified bucket game that I'm going to do, I actually had 2 goals for both dogs. One of them was quite a bit larger than the other dog. So I just wanted the larger one to hold its head still over this little stool thing that I use, stare at the treat that I have in my hand and not move. So the stillness and the head hovering off the stool. I didn't want him touching it. I didn't want it to be super high off the stool. I only asked for about 1 inch or so. It may vary a little bit depending on there, but I actually had this thought out in my head before I trained it. For the second dog, she was a little bit smaller. I potentially could have trained her to actually do a nice chin rest on there. But all I wanted for was her to be off of the stool. So her head is back of the stool. I did actually start with her head on the stool just so I can get her used to looking at the treat and receiving it for that. Eventually I did raise my criteria slowly to the point where she was just 1 inch or 2 back from the stool, and kind of the same thing as the other dog where she's staring at the treat and not moving. Rebecca's got a question here. She says, if you have a fear-free vet near you, they are very accommodating and practice cooperative care as well. Yes. There is an organization that accredits trainers, groomers, and veterinarians, which is called Fear-Free Vets, or Fear-Free Pets, maybe. I can't remember. I can probably copy and paste a link into the chat later on, or if somebody else wants to do that for me, that would be great. And you may find some vets in your area that actually work fear-free. So there are certain standards that the organization holds them to, and they need to meet a certain percentage of those standards in order to be accredited. And it means that those vets should not push your dog past the point of an over threshold response, to the point where they're going to freak out, unless there is a dire need for them to do a certain procedure. So our first step that we want to take into training this kind of stuff is plan. So plan your training. We never really want to go into a training session for something that you didn't care about. If it's just an informal training session, you may be doing a little bit of trick training just for fun and enrichment for you and your dog, that might be all right. But if you're going into something that has some serious consequences, or something that you want trained very, very well, like cooperative care behaviors, you want to plan out your training. So the first thing you want to think about is, what are you training? What behavior? So a few examples we may do is a chin rest, the bucket game, lying flat on your side like we saw with that puppy getting the x-ray, an open mouth behavior like we saw with the seal getting the x-ray. A lot of people like to train shake a paw as just a trick, which is cool. I think that's super great, and just training that is enriching for a lot of dogs, but it may also be a fantastic position for nail trims. I have laying flat on the side in there twice accidentally, wearing a muzzle, eye exams, or maybe medication, giving your dog medication. The cockatiels I got here, I have one of them trained so that he can target a syringe. I haven't got to the point of actually administering medication for him yet, but that was the end goal, so that he can put his mouth on the syringe. I can put a couple of drops of fluid or liquid in there, and then when I need to give him medication, if I ever do, I've got that trained. How are you going to get there? So it's not enough to just know what you're training, but it may be super helpful to have a training plan, or like a flow chart of where you're going to start and where you want to end up. So splitting, we talk about splitting behaviors. What that means is breaking them down into smaller steps. If we want let's use a chin rest, for example. If we want our dogs to hold a chin rest on a chair for 2 minutes, starting there at 2 minutes is probably not going to happen. You're almost never going to get that. So we need to split that into small increments. We may actually start with just getting your dog to follow a target or a hand target, like we saw with the giraffe who was getting the x-rays. So they use that big long target stick. For a dog, a hand target is probably good enough. So a hand target would be where your dog comes and touches their nose up to your hand. You can actually train your dog to follow that. So you may be able to ask your dog to touch the hand target and then guide them down onto the chair so that their chin is resting on it. As soon as their chin touches it, you're clicking it in the treat. Eventually, you're going to start asking them to hold it there for a little bit longer and a little bit longer and a little bit longer until you get to that 2 minutes. And then what are you going to do with that? So now that you've got this dog who can chin rest, you need to be able to move around them, touch them, hold them, maybe lift up their gums and check their teeth, things like that, manipulate the tail, touch their feet. All of that needs to be trained, and you're not going to get there overnight. It starts with just small movements and moving your hand towards the dog, moving a little bit closer, touching them, just tapping them, putting your whole hand on them, however it is that you plan to get there. The important thing is that you plan for it. The smaller you can split behaviors, the easier it'll actually go for your dog. It's clearer, everything you're asking them for, and it's more rewarding for them as well. So baby steps as well kind of ties into that. And we can also go back to the working at your dog's pace here as well. So it's not about what you want. Even you may have a certain plan in mind. You may have split that plan into itty bitty tiny baby steps. But if your dog says that's too big, then you need to be able to adjust your plan. So plan for errors. So what are you going to do if your dog pulls away? If you're going to do a nail trim, you train that shake of paw, you have the paw in your dog's hand, you grab the nail clippers and start moving towards it. If your dog pulls away at that moment, what do? Plan for those errors, and think about what you're going to do when those errors happen. And then finally, this is something I just heard the other day, so I thought I would add it in, is intentions over goals. So when we set goals, we generally think of, we want to have something accomplished by a certain date or a certain time. So if you go into a training session with the plan that you're going to teach your dog to let you touch his nail with the nail clippers in that training session, that is your goal, and that doesn't happen, that can be discouraging. But if you change your mindset a little bit to intentions over goals, where you have the intention of doing that, then if you don't get to that point, that's maybe not quite as discouraging. Intentions to me don't seem quite as concrete as goals. So mindset matters. And if you don't get to where you planned on getting to in a certain day, that's okay. Right? Just come back in the next session, try in an hour or two, or tomorrow, or whatever it is you need to do whenever you have time. So once you have your plan, you can start training. So before you actually start training, you should get all the supplies you need. So clicker treats, if you're doing the bucket game, you need a bucket, maybe grooming supplies, medical supplies, a table or chair may be helpful. Think about how long you're going to train for. A puppy or a dog that's not super used to training for a long time may want a shorter training session. For some dogs, 10 seconds, 30 seconds is a long time. For other dogs, they may be able to train for 10 minutes at a time. I'd say probably I like to keep things relatively short, a couple of minutes at a time, with a break in between, where you can actually evaluate your training session, which we will get to on the next slide, and then go back. So short sessions, again, work at your dog's pace. Don't overtrain them. So again, don't go for too long to the point where your dog says, this is actually getting frustrating, boring. Maybe they're getting full if you're using a whole lot of food and things like that. Leave them wanting more. So really what you should be doing is ending your session at a point where they say, hey, I was having a whole lot of fun there. Can we keep going? Which you may come back to in a little bit, but we don't want them to get to the point where they say, okay, I'm actually done with this. Let's go do something else. You would ideally end your session on a high note. So don't wait for the point where your dog's maybe getting tired and making mistakes, or you're getting frustrated and making mistakes. If you see let's say you have 10 treats planned out for a session, that's also another good way to time your training sessions is by treats. Do 10, 15, 20 treats that you're going to do for that entire session and stop there. But if you have those 10 treats, let's say, and on treat number 6, your dog makes a really good decision or skips over a couple of steps in your plan, I might just toss the dog the rest of the treats I have in my hand and end right there. And then also, how are you going to end your session? So a lot of people like to have an end of session cue or ritual, we might call it. There has been studies done where if you end your training session with something like play, your dog is actually more likely to remember what you were doing. Your training may go faster if you do something like that. Maybe ending with a treat scatter, telling your dog all done and throwing a handful of treats on the ground, so that they're not getting overly frustrated when the session ends. Because if they are having a good time and you cut that training session off, that would technically be punishment. So we want them to not look forward to the end of the training session, but have it not be so aversive. So play, treat scatters, things like that, maybe ending with a Kong or a licky mat, so that they have something to say, hey, that was not quite so bad. And for some reason I included that intentions over goals part in this thing, or in this slide as well. Must have been important. After we do our training session, so we've gone through our 10 or 20 treats or minute or 2 minute training session, we want to evaluate that training session. Ideally, we would be recording the session on video. 99.99% of the world, I'm sure, has smartphones that can record videos now. So we got some kind of prop you can use to prop your phone up if you need to, or you may even go out and buy a tripod that has adjustable feet and stuff like that, so you can get lots of different fun angles and you can get the best recording you possibly can. Whatever works for you, doesn't matter. Ideally, you are recording all your training sessions though, so that you can go back and watch them. A lot of people like to watch their videos in slow motion as well, so maybe at half speed. You'll see a lot of things that you can't see at full speed like that. Maybe little ear twitches or eye twitches from your dog, or maybe you might notice that you actually did not click before you started moving your hand. You should always click and then move your hand. Make notes of what you did, what went really well, what didn't go so well. Track your progress as well. So learning, training, behavior is not a linear process. You will probably almost never see, if you were to record and track progress and graph it, a vertical straight line. It's probably going to be high, lots of peaks and valleys in it, lots of little mountains and dips, and that kind of stuff. On the right here, this one thing you really liked, one thing the learner did, this is not my my information. I got this from Ryan Cartledge of Animal Training Academy. So what he likes to do is record one thing that you did that you really liked, one thing the learner did that you really liked, and one thing you want to improve on in your next session. So when you get there and you are ready to make changes, so this is the part where you're going to adjust your plan. So you may go back to your plan and make adjustments in that. If you need to split smaller, or maybe you need to take a different approach to training the behavior entirely. Ideally, you're not going to make any more than one change at a time. If we make 3, 4, 5 different changes to the plan, and something goes terribly wrong in your next session, or something goes really well in the next session, we don't know what actually made that change. It may have been potentially a combination of all those things, or it may have been one of those 5 things that you changed in that whole session. Small changes can make a huge difference. Things like timing, treat delivery, where you deliver your treat, how you deliver your treat, things like that make a huge difference. So change one thing at a time so you know what actually made the difference. And finally, progress over perfection. Not all training sessions are going to go as planned, and that's okay. What matters is, did you move closer to your goal behavior or not? Again, you may have planned to be able to train a behavior in a week. At the end of that week, you might only be halfway there. Does it suck that you didn't meet your goals? Because we don't want to set goals like that. Yeah, it may not be a super great feeling, but you did still get halfway there. That's fantastic. So now we have the bucket game. So this is just a video I grabbed from YouTube. So thank the person who recorded it and put it there. I don't know the person at all, but it was the best and shortest video of the bucket game that I could find, so that we're not watching a half-hour video. So you'll notice the dog puts her nose to the bucket. She's working on touching the ear, and she'll do a little touch or move her hand a little bit closer and then feed out of the bucket. So we actually need to train the dog to have their nose to the bucket or sit there and stare at it like that. And then we also need to train them with being comfortable with you handling them as well. So there's a couple of steps that go into this.
Has had an ear in the trauma twice, and even though we make some progress training her, she's still scared of having ointment put on her ear. If I pick up any tube, even if it's just toothpaste, she walks away. The bucket game works for her, and now, a day after filming this, the problem is solved. In this clip, you see me rewarding anything she does with the bucket. Any interaction is rewarded, except from eating from it or pushing it over. Starting when she was just a puppy. Over 10 years ago, she has been taught that looking at the container with food and making the right choice will have good consequences. The right choice is waiting until she is given something, without cues, intimidation, or signals. She has learned that impulse control is the way to get something, not just taking it. This game takes it even further. It's great for husbandry, especially if the dog is scared of some procedures. It also works to prevent problems down the road. Take a small bucket and fill it with treats your dog loves. When your dog looks at the bucket, you mark by clicking or using another marker. You reward by taking food out of the bucket and giving it to your dog. If your dog focus isn't on the bucket, you wait until it is and reward looking at the bucket. Repeat this over multiple sessions. Step by step, train until you can move your hand towards the ear while your dog is looking at or touching the bucket. Next, work on touching the ear, flipping it, opening the tube, etc. You can only continue doing any of these things as long as your dog looks at the bucket. The dog will learn he can influence your actions. Learn gets to decide whether I continue doing something she considers scary. I stop immediately when she lets me know it's too hard for her, by looking or moving away from the bucket. When she looks at the bucket or touches it again, I resume the procedure. This game works so well because it gives the dog control. Plum gets to tell me when she's ready and whether I can continue. I don't force her anyway, don't even ask her to do something. I just mark the behavior I want with yes and reward her for it.
All right. So there's a couple of things I'd like to point out in this video. Now, I don't believe that this lady's criteria was set correctly or was defined to a certain point, or to the point that I would like to define it. If we go back a little bit, there's a couple of times where the dog is touching the bucket with his nose, and there's a couple of times where he's got his head way back and just staring at it, and she's touching him and rewarding him for it. So I think that things would be a lot more clearer for the dog as to what's going on if her criteria was more well defined. I really liked it when it looked like it was really well trained when the dog was actually touching the nose to the bucket. So let's watch that again.
We have good consequences.
I think we'll go back a little bit right there.
Starting when she was just a puppy. Over 10 years ago, she has been taught that looking at the container with food and making the right choice will have good.
So right there, she rewarded him for just staring at the bucket with his head way back.
Consequences. The right choice is waiting until she is given something, without cues, intimidation, or signals. She has learned that impulse control is the way to get something. And
here the dog is touching its nose to the bucket. And look at everything that happened in between that. So in between those two repetitions, the dog was looking at her, moving his head around a little bit. There was a whole lot of lip licking going on there. The dog seemed very confused to me as to what was going on and didn't exactly know what it was supposed to do. If you want to go back, let's watch that one more time. Starting when she was just a puppy. Over 10 years ago, she has been taught that looking at the container with food and making the right choice will have good consequences. The right choice is waiting until she is given something, without cues, intimidation, or signals. She has learned that impulse control is the way to get something, not just take it. This game takes it even further. So that's a really good example of how setting really, really clear criteria can actually make your training better and faster for the dog. So now we're getting to my version of the bucket game. So I'm not gonna lie, I did just record this last night. I broke a whole lot of the rules that I specified for you guys to follow. I trained too fast, I asked for too much too quickly. I was rushing and I shouldn't have been. I should have had this done a long time ago, but I had to do it last night. So it was about 10 o'clock, 11 o'clock by the time I got finished. So I already kind of went over my own criteria for what I was looking for. So for both dogs, looking at the treat or oriented towards it, and they had to be still. For Maya, I did not want her head over the table. It's not a table, it's like a footstool kind of thing. And Tucker, I wanted his head over it. The actual position didn't matter. It was maybe a couple of inches off the thing. And also one major thing I should talk about is they're not trying to take the treat from my hand. So my plan was to at first reward any instance of looking at the treat, which is where you'll see with Maya, which is the first dog. She's got her head looking all over the place. Sometimes her chin is touching the table. But as long as she's kind of staring at it and still for a second, I'm giving her the treat at that point. And I will increase my criteria to the point where her head is back and in the actual position that I want it in. And then from there, I start to build duration. And then we start to shape movement towards the ear, so moving my hand towards the ear. And then I've also planned for some mistakes. So if the dog did try, and there was lots, I think you'll probably see some in here because I was rushing. If the dog tries to take the treat, on my next repetition, I will hold the treat farther away so it's not quite as tempting for them. And so it is a little bit of a longer video. So this one's about 10 minutes or so. And like I said at the beginning here, so I start off with Maya, who's never done this before. I start rewarding any instance of looking at the treat. I did actually have to use the treat to lure her over to where I wanted her. And yeah, I'll probably pause and stop in the video a couple of times to explain some things. Here you see me using the treat to lure her there. She's still for just a minute or just a second, and I give her the treat. Like I said, this is a bit of a modified version of the bucket game. It works for what I'm doing, and it's pretty easy to teach. So it may be a good starting point if you've never done cooperative care with your dog before. But for a lot of procedures, I may actually want to train a chin rest or the real bucket game, because I might want two hands in order to actually do the procedure, whatever it is that I'm going to do. Or you may actually move towards this this particular behavior to the point where you can just place the treat on the table and take your hand away. So there's a little cut in the video here. So I've already started increasing criteria. So now I'm asking her to keep her head off of the stool. Oops, what happened there? Maya knows the treats are all in my pocket, and she knows that I've been using my right hand to pull some of them out of the pocket, and she's expecting treats to come from there, which is why she's one of the reasons why she's staring at me like that. Later on in the video, I do actually run into a similar issue with Tucker, and I had to show him multiple times that there was no treats in that other hand. And then all of a sudden he started realizing what was going on, and everything moved really, really quickly after that point. So I'm still asking for a little bit of duration. So it went from just waiting for her to look at it. Now I'm getting about a second of duration there. Here's another cut. Should be starting to see a little bit more duration coming up here. As you can, second and a half, 2 seconds or so on that one. Right there, I tossed the treat away because she was moved a little bit too close to the stool. I wanted her to stand a little bit back a little bit farther. So I just tossed the treat away so that she could reposition herself. So you go to that other hand. Now this is Tucker. So Tucker picked up on this really, really fast. Notice that I hold my treat a lot farther away from him. A lot easier for him to get it. Here you can see I move my hand a little bit, and it's a little bit distracting for him. And it's been a couple of repetitions here that I figure out that he's thinking treats are actually coming from that hand, but I need to show him there's nothing in there. And now all of a sudden he figures it out. He keeps staring at that hand. I'm gonna go to touch on, made a little mistake there. That was just a really brief touch. I barely even touched his fur. See, on that repetition, I actually tried to grab his ear, which was a little bit too much for him. So I moved back, adjusted my plan, and went back towards just touching his ear just a little bit rather than trying to hold it. And a little too much too fast. This is, I took a little pause in the training. I took a little break. And I start off with just showing him, hey, we're playing this game again where you stare at the treat and then you get it. And in another repetition or two, I'll probably actually start going towards touching him again. And now I'm actually able to hold his ear a little bit. I actually flipped part of his ear up in that one. You can see I was able to pick his ear up. And now we're actually looking inside of his ear. Okay, and then we're done. So like I said, that was not my best training session ever. I recorded it late last night. But it does show how some animals you need to work a lot slower. Maya, I wouldn't have been able to train that whole thing looking into her ear in a night. Whereas Tucker, I was able to, hack my way through it and get it done pretty quickly. Some animals need a lot longer for training sessions, and some need, or for training time, and some don't need quite as much. So that's the end of my presentation. I have no more slides for you. I'd like to thank everybody for joining me. All the way back here. Again, if anybody joined in late, my name is Bob Siemens. I own and operate Unity Training and Behavior. I offer private in-home sessions, day training, group classes. I can also do virtual consultations. So if anybody needed any kind of help or assistance with training any of these kinds of behaviors, I'm happy to assist with that. If anybody has any other questions from any of this, I'm happy to do a Q&A period. There's one question here. Do you have any advice on how to apply cooperative care in a boarding daycare center? For example, if a dog needs meds. What kind of meds are you? Is it just pills, or is it maybe eye drops? What's going on with that whole situation there, Rebecca? Show the first couple of slides. Yeah. So the agenda. So first thing we went over is what is cooperative care. So it's ear and eye drops you've had the hardest time with. In a daycare setting, that could be super difficult because you may not have a whole lot of time to work with the animal. A lot of times those ears and eye drops only work for a couple of maybe a week or 2 weeks. It's not like you're using them consistently. What you might do is just get like an empty bottle or something like that, and then maybe you could start training it in that context with certain dogs. If you know a dog maybe has recurrent ear infections or something like that. Yeah, pills are really hard. If the dog is super smart or is a good detective. But yeah, so you might, if you have a dog that has chronic ear infections and you know this is an issue and giving them their meds is difficult, you might just grab an empty bottle and start training it like that, and maybe potentially move on to putting something like water in it, so that you're putting a couple of drops of water in their ear or in their eye, something that's not going to hurt them. And then when the time does come for actual medication, then you've got it trained. For pilling dogs, so for giving dogs pills, one thing I've found that works really well with my dogs, I've tried a lot of different things. There are a couple of things where people will, line up 5 or 6 treats on the counter. 3 of them will be like pieces of chicken or something like that. 1 will be a pill, and then the next 2 will be chicken. And then people will toss a piece of chicken, and your dog has to be able to catch to do this. So the first 3 will be chicken. The dog catches it. The next one is a pill. You toss it, the dog catches it, swallows it, and then you quickly follow that up with the last couple of pieces of chicken. Did not work with my dogs. As soon as that pill hit her mouth, she knew exactly what was going on and spit it out. I've tried putting it in things. She quite often finds it like that. What I found works the best for my dog is actually, so I'll take the pill, I use yogurt or something like that, dip it in the yogurt, but I make sure that I get a little bit of extra on my fingers. So I hold the pill up over her head, she goes to lick it, I drop the pill in, and then I continue to get her licking the rest of the yogurt off of my fingers, and she doesn't even notice the pill. It goes right down her hatch. So yeah, preparing for these kinds of things, like I said, if you know that you have a dog that has these kinds of chronic ear infections, if it's a dog that's never had an ear infection before, you may not be able to predict that and train it. And then training dogs that you may or may not actually have to do medical care with may be a waste of time in that situation. So In a daycare kind of situation, it may be difficult if you have a trainer in your daycare or you do day training or something like that. There may be something to discuss with the trainers. Patricia, you're very welcome. The recording is going to be available. Like I said, it'll probably be about a week or so before I get it up, but it will be posted in the group for you guys. How you train a dog to open its mouth. I'll probably actually have a video of it somewhere. I think if you go onto my Instagram, Lauren, did I go far enough for you, or do you want me to keep going forward a little bit on the slides? We have some videos here. But Rebecca, if you want to go to my Instagram, I've seen a number of ways to do it, and for each dog, it's going to be a little bit different. Thank you, Lauren, for letting me know. Like I said, if you go to my Instagram, you'll be able to see a quick little video of how I trained one of my dogs to open her mouth. And what I did is I thought, well, if I hold my fingers like this, like I was doing like the A-OK kind of sign, or I'm able to give the dog a treat, they often just want to take that treat out of my fingers. So their mouth opens automatically. So that's how I taught it. So I started giving them pretend treats, or maybe you might call it air cookies or whatever you want. And as soon as their mouth opened or their teeth made contact on my fingers, that was the moment I clicked. I started building a little bit of duration on that. And then eventually I started just opening my fingers just a little bit and clicking and opening fingers a little bit, and clicking and opening a little bit more and clicking to the point where I had to hold my dog's mouth wide open. And then slowly I started, moving hands around and things like that. I want to be able to look at her mouth. There's lots of ways to do it. I've seen people, make a little hook with their thumb like this, and somehow they were able to get that work to happen. It didn't work for me. I tried it. What I found working was giving them that air cookie. Worked really well. Yeah, I do think a lot of dog owners and trainers and veterinary professionals and groomers and a lot of people should know this information. Hopefully I saw that there are one or two at least in the audience tonight. So thank you guys for being here. And thank you everybody else as well. If anybody has any more questions, now's the time to ask. One other thing I will mention, I forgot to add into the slide, was that when you're training these kind of behaviors, you want to start in generally a low distraction environment. For some grooming and medical procedures, that's all you need is just that one environment. You may be able to do those procedures in your living room. But if you want to take it into, let's say, the vet's office or something like that, you may actually need to talk to your vet and book a time. Say, hey, look, can I come in for 5 or 10 minutes while you guys are closing, or maybe before you open, or if they have an open room or something like that during the day, and practice those behaviors in there. And if you can, wrangle in a vet to maybe just stand in the room for a little bit while you practice, get them on their knees while you practice, maybe get them involved in touching the animal a little bit. Can the vet look in their ear? Just because you can do this in your living room or your home environment or wherever it is that you're training doesn't mean your dog's going to be able to handle this in a different environment with other people around as well. So you may actually need to train all of that kind of stuff as well. There's a lot that goes into this. So yes, I don't see any other questions coming in. So again, thank you everybody else for being here. I had a great time. I hope you guys learned something as well.